Let's jump into the detail of how the joints are classified. If we talk about the classification based on histology or the structure of the joints, they are classified as synarthroses and diarthroses. Synarthroses, these are solid joints that do not have a cavity. These joints are further classified depending on the connective tissue that binds the bones together as fibrous joints and cartilaginous joints. Second type of joints are those that have a cavity. They are known as diarthroses joints. These cavitated joints are commonly known as synovial joints. Let's go through the details and examples of these joints one by one, starting with the fibrous joints. A fibrous joint is a fixed joint where fibrous tissue, comprised primarily of collagen, connects bones. Fibrous joints are usually immovable and have no joint cavity. These joints are either immovable or permit a slight degree of movement. These can be grouped in the following three subtypes: sutures, gomphoses, and syndesmoses. Sutures are immobile joints in the cranium. The plate-like bones of the skull are slightly mobile at birth because of the connective tissue between them, termed fontanelles. This initial flexibility allows the infant's head to get through the birth canal at delivery and permits the enlargement of the brain after birth. In a suture joint, the edges of component bones usually shows reciprocally adapted irregularities, which ensure a more effective interlocking between bones. According to the shape of bony margins, the sutures can be plain suture, simple apposition of relatively flat surface, for example, internasal suture. Serrate suture, the edges are saw-like, for example, interparietal suture. Squamous suture, these sutures show reciprocally beveled bone margins that overlap each other. For example, temporoparietal suture. Denticulate suture, small tooth-like processes can be seen on the bony margins, for example, lambdoid suture. Shindellosis type, a ridged bone fits into a groove of neighbouring bone, for example, between rostrum of sphenoid and upper border of vomer. An adult skull looks like this, whereas a neonatal skull reveals fontanelles, which are temporary in nature. At 6 specific points on the sutures in newborn skull are membrane-filled gaps called fontanelles. These allow the underlying brain to increase in size. Anterior fontanelle is used to judge the hydration of the infant. All these fontanelles become bone by 18 months of age. As the skull enlarges, the fontanelles reduce to a narrow layer of fibrous connective tissue called Sharpey's fibers that suture the bony plates together. Eventually, cranial sutures ossify. The two adjacent plates fuse to form one bone. This fusion is termed synostosis. The second subtype of fibrous joints is known as gomphoses. A gomphosis is a specialized fibrous joint in which a conical process or peg of one bone fits into a hole or socket in another bone. Example of gomphoses are the immobile joints between the teeth and their sockets in the mandible and maxillae. Small quantity of fibrous tissue holds the bones together. No movement is possible at such a peg and socket joints. The third type of fibrous joint is called as syndesmoses. Syndesmoses are slightly movable joints, also called amphiarthroses. In syndesmosis joints, the two bones are held together by an interosseous membrane. For example, bones of the forearm are connected to one another by interosseous membrane. The ulna attaches to the radius, forming the middle radioulnar joint. The tibia connects to the fibula, forming the middle tibiofibular joint. Those were the 3 subtypes of fibrous joints. Now let's look at the cartilaginous joints. Cartilaginous joint. When two bones are articulated via cartilage, they form a cartilaginous joint. In cartilaginous joints, the bones attach by hyaline cartilage or fibrocartilage. Depending on the type of cartilage involved, the joints are further classified as primary and secondary cartilaginous joints. Primary cartilaginous joints, also known as synchondroses, only involve hyaline cartilage. This type of joint is not considered to be a true joint, as they are temporary. They are usually immobile, also called synarthroses. Some may allow slight movement, making them amphiraphroses. The joint between the epiphysis and diaphysis of growing long bones is an example. When the growing edges of the ossification center of a developing bone come together, a residual plate of cartilage may persist unossified between them for a number of years. This is known as a growth plate. Such a union is referred to as a synchondrosis, or primary cartilaginous joint. Synchondrosis is a temporary joint, chiefly meant to allow the growth of endochondral bones. When the optimum growth has been achieved, the hyaline cartilage is replaced by osseous tissue. The secondary cartilaginous joint, also known as symphyses, may involve either hyaline or fibrocartilage. These joints are slightly mobile, called amphiraphroses. At a symphysis, the opposed bony surfaces are coated with hyaline cartilage and united by fibrocartilage, usually in the form of a disc. The bones are further united by ligamentous bands. A classic example is the pubic symphysis. Other examples of symphyses are between the manubrium and the body of the sternum, between bodies of vertebrae. That is all about the cartilaginous joints. Let's add what we learned to our flowchart here. We've finished studying the synarthrodial joints. Now let's move on to the diarthrodial joints. The diarthrodial or the synovial joints are freely mobile and are considered the main functional joints of the body. If we look at its structure components here you can see the two bones. Its joint cavity characterizes the synovial joint. The cavity is surrounded by the articular cartilage or capsule, which is a fibrous connective tissue that is attached to each participating bone just beyond its articulating surface. The joint cavity contains synovial fluid secreted by the synovial membrane, synovium, which lines the articular capsule. Hyaline cartilage forms the articular cartilage, covering the entire articulating surface of each bone. Here, the W-shaped highlighted part is the synovial membrane that surrounds the joint cavity and articular cartilage. The articular cartilage and the synovial membrane are continuous. Some synovial joints also have associated fibrocartilage, such as menisci, between articulating bones. Within the joint cavity may also be present fibrocartilaginous structures like articular discs, menisci, and labra. We talked about how the synovial joints are the most freely moving joints of the body. The types of movement that they allow are gliding movement, in which one plane bony surface slides over another plane bony surface to a limited extent. Angular movement, which involves an increase or decrease in the angle between the bones taking part in the formation of the synovial joint. For example, flexion, extension, adduction, and abduction at the shoulder joint. The third type of movement is the rotatory movement. In rotatory movement, a bone moves around a longitudinal axis. Examples include medial and lateral rotation at the shoulder joint. And lastly, we have circumduction. It is a combination of all three movements, such as flexion, abduction, extension, adduction, and rotation. Circumduction occurs at the shoulder and hip joints, as well as the carpometacarpal joint of the thumb. Synovial joints are often further classified in three ways: according to the complexity of the joint, according to the degree of freedom of movement, and according to the shape of the articulating surfaces. If we look at the complexity of joint criteria, we see three types of joint here: simple, compound, and complex joints. The simple joint is the one where one concave bone articulates with the other convex bone. An example of this is the shoulder joint, in which the concave scapular part articulates with the convex head of the humerus. Next is a compound joint. These are the joints that are formed more than two bones are articulating. For example, the elbow joint, in which the humerus articulates with the ulna and radius. The third is the complex joint. This is the type of joint that contains an articular disc. For example, the knee joint. Now, according to the degree of freedom of movement, synovial joints can be uniaxial, biaxial, and multiaxial. The uniaxial synovial joints are those that have only one degree of freedom, meaning that the movement is limited to rotation around the principal axis of the body. An example is a flexion and extension at an interphalangeal joint in the transverse axis. The biaxial joints possess 2 degrees of freedom, meaning movement can occur in 2 principal axes. The wrist joint is a good example of the biaxial joint. The flexion and extension of the wrist occur around the transverse axis, and the abduction and adduction occur about the anteroposterior axis. Lastly, the multiaxial joints have 3 degrees of freedom and permit movement in all 3 principal axes. An example of such a joint is the shoulder joint, where circumduction can occur. The last criterion for the classification of the synovial joint is according to the articular surface. There are 6 types recognized by the anatomist based on the articular surface: pivot joint, hinge joint, saddle joint, condyloid joint, ball and socket joint, and plane joint. Here you can see that the articular surfaces of the 2 joining bones are of different shapes, from the pivot joint to the plane joint. Examples of these joints in the human body are: an atlantoaxial joint is a pivot joint. Elbow joint is a type of hinge joint. The carpometacarpal joints are a type of saddle joint. The metacarpophalangeal and wrist joints are an example of condyloid joints. Shoulder and hip joints are ball and socket joints. And lastly, plane joints can be found as intermetatarsal joints and the joints between the tarsal and carpal bones. That is all about the structural classification of joints. You can pause and review the flowchart illustrating this classification of joints. You can also find a link to the PDF file of this lecture, so you do not have to worry about making your own notes.
Have you ever heard of